Hi, I'm Dr. Rachel Miller, physical therapist and certified Pilates instructor. Today I'm giving you a sneak peek into what a pelvic floor exam looks like with us. We start with lots of questions, bowel and bladder history, pain, all sorts of things. We go into a normal musculoskeletal exam, meaning we're assessing range of motion, flexibility, strength of your core, your hips. And then with your permission, we will do an internal pelvic floor assessment if we think that's appropriate. We do not have to do this, but it is the best way to get information about your pelvic floor. And so here is what it looks like. We have Penelope, our pelvis, and so we will have you get undressed from the waist down and lay with a sheet covering you. And we start with observation. So we're looking at the bottom of the pelvic floor here, right? The base. And we start with just observing what happens when we ask you to contract and relax the muscles. We also start with some assessment for this external layer to see if there's any tenderness or tightness in any of these muscles. And then we will go into layer 2 and 3, which you can see what we call the pelvic bowl here. That's your deepest layer of pelvic floor muscles. And so this is the same view as this. And we're going to switch over to this one because it's a little bit easier for me to show you. So what happens when we get into the internal layer is we'll take one gloved finger, no speculum or anything like that. We will insert it vaginally and we will just go a little bit to get to that layer 2. We'll assess for tenderness and tightness. We'll assess for strength. Then we get into layer 3. In layer 3, we get the opportunity to kind of wrap around to the sides, again, assessing for tenderness or tightness, assessing for strength, muscle endurance, coordination, and timing. And we do that on the right, and we also will do the same thing on the left. A lot of times there's a big difference between what your muscles on one side are doing versus the muscles on the other side. That can correlate with people that have back pain or hip pain on one side, hip stiffness on one side. It's very interesting to find. And then usually when we're in here anyways, we will start to do some retraining. So we will either release muscles that are tight or teach you how to be able to relax and release those muscles on your own. Or if you're just needing strengthening, we will work on what cues give you the best muscle contraction and what parameters you need to work on strengthening. So Kegels are not the answer for everybody, and having a very specific guide of your strength is good, but you need to work on your endurance or you need to work on those fast twitch muscle fibers. We want to get very specific with how you're retraining them. And so that's what we're doing when we are doing our internal exam and some of our retraining or treatment. Once you know where your pelvic floor is, you know how to contract, you know how to relax, then we work on integrating it with the rest of the core system and work on getting that functional automatic response.